Next, you are going to assess the infant's reflexes. The first one is the rooting reflex. So with holding the infant to assess the rooting reflex, you are going to gently stroke one side of the infant's face, and the infant's head should turn towards the side that you stimulated, and that should disappear at about 3 to 4 months. Next is the Moro reflex. You're going to have the infant in a sit position. You're going to support the head and chest, and then you're going to let the infant fall a couple of inches. The arms and legs should all extend, and then the arms should return midline in a C shape, and any asymmetry in the flexion or extension of the arms or legs, specifically the arms, could indicate a brachial plexus injury. And that'll disappear at 4 to 6 months. Next is the Gallant reflex. You're going to place the infant in ventral suspension, and then you are going to stroke down one side of the infant's spine, and the infant's hips should turn in the direction of the side of the spine that you stroked. That should disappear at about 4 to 6 weeks. Next is the sucking reflex. You're going to place one gloved finger inside the infant's mouth, and the infant should vigorously suck. Next is the tonic neck reflex. You're going to lay the infant supine on the examination table. You're going to turn the infant's head towards one way, and then the arm and leg on the same side which the head is facing should be extended, and then the arms and legs on the contralateral side should be flexed. You're going to repeat that on the other side, and that reflex should disappear at about 6 months. Next, you have the Palmar grasp reflex. You're going to place your finger on the infant's palm, and the infant should firmly grasp your finger. That should disappear at about 3 months. The stepping reflex, you're going to support the infant under the arms and let his feet touch a flat surface, and you're going to see the legs flex and extend in a walking pattern. That reflex should disappear at about 4 to 8 weeks. Next, you have the Babinski reflex. You're going to take the bottom of the infant's foot and stroke from the heel to the toes. You're going to see the toes hyperextend and fan out, and that reflex should disappear at about 2 years of age. If you're seeing any absence in these reflexes or persistence longer than after they should have disappeared, that can indicate a brain or spinal injury.